Hi there, I'm Jill Webb and I run a small training company called Jill Webb Training. One of the sets of courses I offer are first aid qualifications, and I get lots of questions on those about head injuries because they can be really worrying, whether to a child or an adult. The kind of signs you're going to see that somebody's got a head injury: they might have a headache, they might have a scalp wound where they've fallen over and banged themselves, they might be feeling dizzy or tell you, "Oh, I feel really sick." You might notice they're a bit confused, they can't remember what's happened, and you might be concerned that they're beginning to not respond to you as well as they were. And of course, think about where you found them. Is it likely they might have hurt their head? In order to manage head injuries well, you need to remember what you've learnt about what we call the APVU scale, which is appearing on screen now. The APVU scale is a really simple way of describing levels of consciousness. So is the casualty alert, responsive to voice, responsive to gentle pain, or unresponsive? And when we're managing head injuries, we need to keep a really close eye on whether the casualty's level of consciousness is decreasing, whether they're becoming less responsive through those levels. I'm pleased to have my son Simon here as an assistant today. Simon has suffered a minor head injury, perhaps slipped over and banged his head playing games or something. So what I'm going to do is apply a cold compress. This might just be a towel made very cold with cold water. You may well have something you keep in the fridge. I'm going to pop it there and I'm going to ask the casualty to hold it for himself. If he had a scalp wound, I would treat that in the same way as I would do any minor bleed. After you've treated this wound, the really important thing is to keep an eye on your casualty for at least 48, even 72 hours afterwards. Should things begin to deteriorate, so they begin to get a bit confused, you find that they're being sick unexpectedly or even have a seizure, then you need to treat this as a severe head injury because they are dropping in their levels of consciousness through the APVU scale that I discussed earlier. Thank you, casualty. So I'm going to talk now about what to do if you come across a severe head injury. It might be the situation I've just demonstrated where a head injury looked quite mild initially and things deteriorate, or you might find someone you suspect has had a severe head injury. Clues to that might be fluid coming out of their ears. Clear fluid coming out of your ears or nose is not good news because it's the fluid that goes around our brain and we ideally want it to stay there. You may find that the casualty, if they were responsive, has become unresponsive, so they're not responding to you. A really good tip is pupils. Pupils should be equal in size and react to the light. So you may find if you just pull down the eyelids that you notice, and it's really quite distinctive if you see it, one pupil larger than another. And of course, there's common sense. There's where you find the casualty. When I'm stood here, it's fairly unlikely that I've got a head injury. If you found me on the floor underneath a collapsed ladder, you might think a bit differently. With any severe head injury, we're calling 999 and we're telling them that we suspect a head injury. So we're asking for urgent medical attention. While that is on the way, we are trying to maintain a stable airway. So if you've watched my earlier videos about dealing with an unconscious casualty, you'll remember we talk about the airway, we talk about the head tilt chin lift to replicate this. So you've got your airway open and you can breathe. If you find a casualty with a head injury, maintain the airway as best you can in the position you found them in case of a spinal injury. The best way to do that often is to take both your hands and gently put them on either side of the head, holding the head as still as possible. And you're trying to maintain that airway until help arrives. Pay very, very close attention to breathing and be prepared to start CPR if they're not breathing. It is a frightening experience, a head injury, and I hope that's just helped you to understand a little better what to do. Thank you.